respect, the flattest, because look, it turns, just like the muscle here.
Yeah.
It turns, so I want it to be the flattest part of the vein. So go ahead and remove that real quick. Hold a tight fist, give it a couple seconds. So there it is. See that? Now I'm feeling it coming down. Try not to hit the table. And then I'm gonna have him hyperextend. Now, because I want it straight, I'm not gonna take the needle down his arm. It's not only the straightest part, it's the flattest now. And I'm coming down, and it feels pretty good here too. Even though you can't see it, I can feel it, right? You're okay getting blood drawn, right? Okay. So now I'm gonna check my anchor. When I anchor down here, I'm anchoring with my thumb further down the arm so that it doesn't interfere with my degree of angle, right? So that now I found my site. What degree of angle on this vein?
20.
I would do like
No, not 20.
10.
Yeah, 10. It's on the
can't see it.
surface. Remember that superficial
you guys.
veins, it's a lower degree of
did.
angle. Now remember where you release your tourniquets, not up here, right?
closer to the.
It's right here. That way it's a quick release and it doesn't move the arm. Okay, now I'm going to clean my site. I'm actually going to have him turn his arm a little bit like that, from the center out. Look at my alcohol prep pad. Do one more. Now this is what I'm going to be watching for that you're doing this technique and looking at it to see that there's no discoloration, right? Remember that?
Mm-hmm.
Now's my 30-second dry time. I'm going to assemble my equipment. Remember I said don't grab your equipment till you decide which vein, which arm. And I didn't survey the other side. I kind of did already, but so. All right, when you take these butterflies out, when you take them out, you pull them out, you want to make sure you're ready to assemble it. Now, does this look familiar?
That goes in the
Right?
Yeah.
What's under that rubber sheath?
Hub.
needle.
A needle.
Oh.
A needle, right? A needle. So you don't want to grab it. When you take it out, you want to set it down on the table. The table is not sterile. When you take this out, you want to put it right
Bless
into
you.
the hub. But this end comes off because what would I attach here?
You can put a syringe.
A syringe. A syringe here. And what would I do with this if I put a syringe there?
Discard in the sharps container.
In the sharps, because there's a needle, right? But because I'm going to use a hub on the arm vein, I'm going to go ahead and put it into the hub. Now I've got 3 pieces to push and make sure it's nice and snug together. All 3 pieces, so it doesn't come apart, because it can come apart if it's not snug. And blood will be coming, and you've got blood coming through, and you got to reattach.
Oh,
It can
child.
get messy. All right, butterfly needle. It's called butterfly because it's got wings, right?
Yeah.
This one has a safety device. This is it, the yellow. I would actually push and slide it over and it'll lock. Some safety devices have buttons. I'm gonna have another one tomorrow, a different one for you to look at. Has button where you either squeeze from the side or squeeze from the center. Once again, healthy budget. What can your company afford and what they're gonna provide you? You may have butterflies, but you're gonna have on the mannequins that don't have any, so in the sharps container. Now, a couple ways to hold this butterfly. If you hold it up like this, you gotta make sure, like up like this, you gotta make sure you can see the flashback. That's why people like butterflies, because as soon as you access the vein, accessing the vein is the needle's in there, you're gonna see a flashback of blood in this chamber right away. On some of these mannequins, the solution is lighter, so you have to take a closer look to see.
Yeah.
All right? You're looking for the flashback of blood. If there is no flashback in blood, are you going to put the tube in?
No.
No. What are you gonna do?
Relocate.
Relocate.
Yeah, you're gonna do your assessment, repalpate, right? You're gonna do that assessment first before you put the tube in. The other way that you can hold these butterflies is just by the wing. This is how I do it because I've done pediatrics and I've done a lot of hand veins, and I'm anchoring and holding, so I do one hand. And I actually use my dominant hand, I use my thumb and my index finger, I move these out of the way, and I insert like that, because when I do a hand vein, if I grab like this, first and foremost, I cannot see the flashback. See that? And I've increased my angle greater than 15 degrees because my hands are larger. See that? And so I've trained automatically now just to hold like this, and when I come in, hold your hand in a fist. When I anchor and I do the C-hole on a hand vein, I move these out of the way so I can come in like this at a lower angle and it doesn't affect. See that? I do not recommend you holding the butterfly like this, because eventually you're gonna have to move those fingers to see and what's happening with the needle.
Moving.
It's moving and nicking the walls of the vein, right?
Can I see how you're holding it on just from this angle? The needle, the butterfly?
Like that.
Okay.
Okay.
And that'll help with these cephalics on the side, moving these fingers out of the way and anchoring and going in like this. Lower degree of angles, you want to look out for that. The other good thing about butterfly needles is that you can just preload, not push through yet, because we haven't accessed the vein. We haven't seen the flashback yet. You just lay the tube inside so you're ready to push. Okay? So now I'm right-handed, so I'm going to set this here. I gotta get my gauze. Now, because of this space here, I'm gonna move them over just a little bit more and then put this under your elbow like that. And so I have space for my equipment on this side. I'm not gonna grab tape because I'm actually gonna do my 1 minute applied pressure time. And you wanna do that with each other.
Oh, okay.
1 minute, you're not gonna even put the tape out like you're doing with the mannequins, because you gotta do your 2-point check. I know on the mannequins, you're just going, and maybe you're doing it or maybe you're not anymore. Now you must and have to do it, okay? Just like timer, so who wants to be my timer? Who's got a timer to set for 1 minute? Okay, set it for 1 minute. So when you are the timer, remember 4 to 6 inches above. When your phlebotomist ties and lets the tourniquet go, that's when you hit start. And when we get to TTG and release the tourniquet as the timer, that's when you stop the timer. And you let the phlebotomist know how many seconds they have left. How long did it take them to do that? So Rania, you're gonna, when I let it go like this, you start the timer. These, once again, caps, just twist to remove it, making sure my bevel is up. I'm gonna come down. You okay? Hold a tight fist. All right, I'm gonna come down, turn your arm out a little bit. There we go. I'm gonna anchor. I have my fingers out of the way, low degree of angle. 1, 2, 3. There's the blood. Now I'm releasing my anchor. I'm grabbing this, open your fist. It popped out, that means good pressure, there's blood in there. I'm going to my TTG, take my tube out, watching my, now butterflies you can let go. But if they start twisting and moving, you want to take hold of it again. But for training, I want you to hold on to it. And then now I'm going to take it out. Once again, I need to see the needle come out of the arm. I'm going to hold it up here, and I'm going to take it out. 1, 2, 3, out fast. Go and apply pressure right there. Lots of pressure. You want to show them how much pressure. Now, here's my needle. They run the higher risk of accidental needle sticks because of this. What you do with the needle. So you want to turn it over. See how I moved it away? Turn it over. Have the bevel facing down. For the safety device, you're just going to hold the wing and hold this and push. Not the tubing. The tubing, blood's going to come out of the bevel. So I'm just going to, if you see here, look, it just slides. You just push it and it slides.
Can I see?
Hold the wing.
Oh, wow.
And it
Okay.
slides. It's locked now. See how it's locked? So first things first is you're going to take care of your needle. Put that in the sharps. And then you would do your inversions, right? And blood in tubes go in the sharps, right? And now I'm going to take care and just get, while he's doing the 1 minute pressure time, I'm just going to throw all my stuff away here. Get my tape out.
Did the timer go?
So that's the one, and I'm watching his fingers, making sure he's maintaining that pressure. Because if we're talking and chatting and he's just like letting up, like then I'm gonna say more pressure, please. So you're always keeping an eye on that, right? Because you're not gonna let him go. And then if you don't mind just turning this tape over like that for your next person. And then let's just do the 2-point check. Looking for blood in, blood out. Looks good. Now's the time you want to fold the gauze into force. So if you're not doing that on the mannequins, you want to start practicing that, because if you haven't noticed, doing it with one hand, it's just the mechanics of how to do that. Taking from the center, applying pressure, and pulling out and across for more pressure. Thank you.
Bravo.
Woo!